Have you ever wondered why your body would just attack itself? Well, that's what a lot of people with autoimmune think. Your body's attacking the issues, the nerves, the joints, and the skin. And stick around, because I don't think that's the case. And in a minute, you're going to meet Stephanie, who came into the office acting like she's 80 years old, and now it's nearly all gone. No drugs, no surgery, and no painkillers. Hi, I'm Dr. Jason West and the West Clinic team, and we post about real people, real stories of hope and healing. And if you like what you see, check out the links in the description. And if you're new to the channel, welcome. Thanks for stopping by. And if you want to learn to be healthier and see incredible patient outcomes, be sure to hit the subscribe and bell button so you don't miss out on the stories of healing and treatments that are really changing people's lives. And if you're not new to the channel and you're coming back, you rock. So is it possible for rheumatoid arthritis to be something else? Well, this is Stephanie and Dr. J in the West Clinic, and here's the story. Hey everyone, it's Dr. West and Stephanie inside the office. It's reevaluation day, and when I was asking Stephanie how she's doing, she said, I'm doing a lot better. And I said, hey, I'd really like to be able to tell your story. And she said, okay, let's go tell it. So, Stephanie, you originally came in the office with what diagnosis?
With arthritis.
So rheumatoid arthritis was the diagnosis, and they thought it was secondary to?
They never said. They wouldn't take my story that I got bit by a cat.
So Stephanie, I think, cat scratch fever, and then what happens is we got an infection into the joints. It inflamed the joints, and then the medical treatments were, here, take these pills.
Yep.
And then I asked Stephanie, so how long do they want you to take the pills? And she said, until I die. I want to do something a little bit different.
Better.
Yeah. And so it was a multifactorial approach. We said, hey, what do we need to do in your emotions and your lifestyle? And let's do a medical nutritional program and then some treatments in the office. And it's been pretty transforming. Mm-hmm. So compared to how we first started to now, how do you feel?
Oh, 85% better.
It's been significant. And
yeah.
So tell everybody how your joints felt before and how they feel now.
Oh, I couldn't walk. I couldn't do anything. Laid in bed days on end. Wheelchair some days. And now I can walk a whole lot better.
It was phenomenal. When I first saw her, I really thought, man, she is like 80 years old.
That's how I felt.
Like
80, 90.
It was literally creeping down the halls. It was hard for her to sit down. It was hard for her to get up. And then there were multiple times when she would go to move and she would grimace. Like you could see it on her face because her joints hurt. Mm-hmm. So Stephanie, you did a whole bunch of things. Like you cleaned up your diet.
Yep. And
you started eating anti-inflammatory foods. And then we outlined a specific medical nutritional program specifically for you, but got you on some supplements. And then tell everybody like some of the treatments that we've done in the office. But I think more importantly than that, because this is so important, tell everybody what you did different from a lifestyle perspective, because it's so empowering when people do that.
Oh, I cut out sugar, carbs, that helped a lot. And then, I don't know.
It was awesome. Like, yeah. I'm so proud of her because it's hard to change when we get addicted to, food pathways and sugar. And she totally did it. Like, she owned it. And then inside the office, we were helping you with some treatments. So what treatments were we doing?
Like hydrogen peroxide.
So hydrogen peroxide IV therapy, it's a 1 to 100 dilution.
The UV light bed.
The ultraviolet blood irradiation treatments and the infrared bed.
Yep.
So the infrared bed basically helps your body to release nitrous oxide. It stimulates your body to help the mitochondrial function, and it's really, really good for circulation. So it helps with swelling and inflammation. And then we did some detox work.
Yep, detoxes.
So ionic foot cleanses, and then we did some neural therapy.
Yep.
And the neural therapy is how we get the nerves to reset, because you have a lot of times with people that have chronic health problems, their nervous system accepts being sick as being normal. And so tell us your initial thoughts about neural therapy and how you feel about it now.
I hated when I got it, but it really helped a lot. Like, I didn't know it could help that much. It's
pretty phenomenal.
Yeah.
And so she hated it because it feels like little bee stings. I mean, it hurts to do the therapy.
But it's worth it in the end.
It is worth it in the end. It's totally changed someone's life. So now we're excited to work with Stephanie. And she can enjoy the holiday. She came bouncing in the office with her sisters today.
And it's a totally different energy about her. It's a totally different presentation. And it's just fun to have cases like this because I think you kind of didn't think you were ever going to feel good again.
Nope.
Yeah, she was like, I just don't know. I'm scared to think that I could feel better.
Mm-hmm.
And now look at you. You're amazing. Your metabolism's better. You look beautiful.
Thank you.
And she owns her health. And so it's just been awesome.
Yes.
Stephanie, is it okay to share this with people on social media?
Mm-hmm.
So it's Dr. West and Stephanie, and it was, quote, autoimmune initially, but it was secondary to infection. We got her immune system working. She started avoiding anti-inflammatory foods, cut down on sugar. We gave her some things to build up her immune system. And these are the outcomes that we expect when both of us do our parts. So Dr. West and Stephanie, we'll see you guys on the next video.
Hey everyone, thanks for watching. Here's exactly what we did for Stephanie. Number one, empower people with knowledge of what you can do to be healthier, encourage lifestyle changes, give the right medical nutritional therapy, IV vitamin C with magnesium and calcium so that it gets the right ratio into the tissues, and then reprogram the nerves because a lot of people are living down here and they should be up here. Now that's a lot to go over, but don't worry. We even wrote a book about it, why we get sick and what to do about it, and you can get it for free by going to our website, askanymedicalquestion.com. You fill in the information, and not only will you get the book, you'll get the report on autoimmune or arthritis or Lyme disease and much, much more. I'm Dr. Jason West and the West Clinic team, and we will see you on the next life-changing event.